Alright, so we are going live here. Dr. Pierre here, your favorite board certified internist, founder of drpierresblog.com, and today we are going to be talking about colon cancer. We're going to give everyone some time to get on. Hold on for a second. We're going to give everybody some time to get on the live stream. I'm going to check my Facebook page, make sure we're all kind of rocking. But again, if you are here, again, go ahead and send some comments, likes, shares. Please share as always. And then we will get these things started. Give me a second. Okay, perfect. So we are... All right, so we are good to go again. Let me just introduce myself. I am Dr. Pierre, your favorite board certified internist, founder of drpierresblog.com, best-selling author, podcast host of the Lunch Learn with Dr. Pierre, weekly podcast, here to educate the masses to help empower themselves for better health. And I'm bringing you episode 56 of the Lunch Learn video, right? And for those who've been rocking with me since episode 1, right, this is where everything kind of started, right, in regards to the blogging and the podcast and everything else. Started with the blogs, went to the video, and now I primarily do a lot of podcasting. But first and foremost, I love to kind of do this thing here with the videos. It's very informal. It's a very quick lesson learned. And for a lot of the people who've been following me from the beginning, right, this is kind of your ease, right? Because again, you can watch this video now while live, or you can catch it later on, right? So much appreciated for all you guys' support. Now, today we have a very important topic, right? So today we're going to be talking about colon cancer. If you've been keeping an eye on the blog and the podcast, you know that I've always been talking about colon cancer. Colon cancer, I've said it before, is one of those cancers that I hate, right? Like, and I hate to use the word hate, but I hate that I take, especially now in the hospital, right? I take care of a lot of patients who get found at a late time frame, right, with the colon cancer, right? Especially in times where we shouldn't be catching it is when I'm catching a lot of these colon cancers, right? And I've had discussions before where I focus on just colon cancer as far as, the diagnosis, treatment, when to get treated, right? And I've even had one where I've talked about, especially colon cancer in African Americans, right? For those who know, I have a very affinity for all medical issues, right? But especially ones that primarily affect African Americans like myself, right? So today, let me get this. Make sure so today we're going to be talking about the newest guideline recommendations from the American Cancer Society, right? And if those who may not be aware, most of them, it's okay if you're not, right? For the Cancer Society, right, for a lot of us, a lot of the things that we do, hold on, let me do my sharing. Share, boop, boop, boop. Live stream. All right. Housekeeping thing where you got to share. I forget you got to share. Not only I have to share my personal group. If you're not part of the personal group, get on that quickly. But I also got to share my personal private page as well. All right, boom, to that share. So for those who, maybe unfamiliar, right? American Cancer Society is our governing body that kind of tells us, how we should treat cancer, when we should treat cancer, how aggressive. It kind of gives us our structure, right? Almost like our cookbook on when we're dealing with a lot of our different cancers, right? And from a primary care perspective, when I was in outpatient medicine, right, we would use these guidelines to know when should we even be checking for it, right? So when we talk about colon cancer, right, this is the topic at hand today. Beforehand, right? So let me give you the old. So beforehand with colon cancer, I used to tell my patients, once you hit that age of 50, right? That age of 50 used to be I would tell them hey, I got an amazing present for you when you hit 50, right? It's time to get your colonoscopy, right? And the reason why, I get so hyped about it because colon cancer is one of those cancers that grows very slow, right? It's a very slow growing cancer. And if you can get the colonoscopy done right, a lot of these times you don't have to get another one done for 5 years, sometimes 10 years, right? So even if for some reason cancer starts growing the day after your colonoscopy, you still have about 5 years before you have to worry about anything, right? Especially for majority of your cancers, right? Very rarely do we get a very aggressive, quick growing cancer, right? Very rarely, right? Especially without us already knowing it. So that being said, right? Before, it used to be age 50, on your birthday, you were getting the best present because you're getting a colonoscopy. But what's happened is the newest guideline says, you know what, age 45 is it, right? And one of the reasons that they cite, right, is something that if you're a Lunch and Learn community member, right, you already knew, right? We're having a lot more younger, right? We're having a lot more younger patients being diagnosed with colon cancer, right? And what I'm going to do is, especially because maybe you didn't know, right? I'm gonna post a link to the blog post I wrote, and let me just give you an idea, how I guess quote unquote old this information is, right? I wrote this blog post March of 2017, right? So March of 2017, they released an article that said like, hey, you know what? Younger people are really starting to get caught up with colon cancer, right? So this isn't something that is surprising those in the medical community, right? Especially those who are, a little bit more academic and who are usually caught up to these things, right? This is something that we were very aware that what was happening is that colon cancer rates were increasing in the young population, right? By young population, the article I read between 20 to 29, we were seeing an increase in the incidence of patients with colon cancer, right? So I'm going to put the link in here so you can get a chance to take a look at that when you need to. So you'll see that link in the comment section. And so what we're seeing is younger people being diagnosed with colon cancer at an earlier age, and other age groups weren't having an increase, especially as much as the younger folks, right? Which is a problem, right? Because again, if I'm telling you that by the age of 50, right, is when I want you to get your colonoscopy, right? But if the younger population, again, 2029, right, is seeing this increase, and now I'm telling them for them to have to wait an additional 20 years, right? And I already told you, it doesn't take long. Colon cancer is a slow-growing cancer, but it definitely is going to grow terribly in 20 years, right, versus 5 to 10, right? And so this was like the onus, right? This was the premise of a lot of the changes, right? Because it noted that a lot more younger people are being diagnosed with colon cancer, right? And we have to be very mindful, especially as clinicians, right? If you're my Lunch and Learn community, you already know like that age 50, right? That age 50 was for the general population, Caucasian male, right? Caucasian male, Caucasian female, right? But if you're African American, I was already telling you, you need to get in at the age of 45, right? Like, because unfortunately, like most medical disorders, right, a disproportionate amount gets affected to African Americans, right? And so I was telling, even though I was saying the guidelines say 50, I was like, no, I need you like getting in and getting checked at 45, right? So now we have guidelines that say, you know what? We need people to start at 45, right? So guess what I'm about to start telling my African American patients, right? When you get about age 40, hold on for a second. Hey, let me call you back. Thank you. When you get about the age of 40, all right, remember I'm in the hospital, right? So ER call. So when you get about that age 40, you need to be thinking about like, hey, is it time for me to get, a colonoscopy, right? And I'm going to be strongly encouraging, right? Because if they're moving this shift, right, if they're going from the age 50 to the age 45, right, for the general population, right, they're not talking about the high-risk patients, right, which again is the patients with a strong family history, right, with the patients with African-American descent, right, the patients male, right. They're not talking about those big ones, right, who are even at a higher risk for the smokers, right. Again, your Lunch and Learn community, again, if you're watching this, right, I don't know why people are smoking, right. Like, again, I say this all the time, right, like, and I'm a proponent, right? You can check back to, I think it's episode 6, right? I think it was, right? If you're going to smoke something, right, in 2018, right? If you're going to like pick up and I'm going to smoke something, right? What's going on, Steve? Like, smoke marijuana, right? Like, don't be out here smoking tobacco cigarettes, right? There's literally I can't think of a single positive benefit that you would get from smoking cigarettes in 2018, right? Like, if you say, you know what, Dr. Barry, like, I gotta smoke something. For some reason, I just have to smoke something, right? I'm gonna tell you again, smoke marijuana, right? Because at least we know there's some benefits over there, right? We know smoking cigarettes is absolutely terrible, right? We absolutely know smoking cigarettes is terrible, and for everything, right? For blood pressure, for heart disease, cancer, cigarettes, right? Again, I've said this before. If I'm doing a medical test, right? If I'm doing a test and it says this person has a high risk for cancer, high risk for a stroke, high risk for a heart attack, high risk for blank, right? And I had to change one lifestyle, right? If I just had to change one lifestyle, what would that change? It would be stop smoking cigarettes, right? Because cigarettes are absolutely terrible, right? Again, sorry to get out of that soapbox. I wanted to kind of say, like, again, for my colon folks who are dealing with colon cancer, right? Like, that's what you got to deal with, right? There's a lot of issues or concerns, right? So for my young folks, right? And again, if you go ahead and peep the article in the comments, right? So the question was like, why are the young people getting colon cancer, right? So I listed in the article, right? Obesity, their diet, alcohol, smoking, right? And they're not getting screened, right? Because again, most of the times we're not even looking at our young folks to be worried about cancer, right? Where there's not, because again, our thought process was, I'm not even checking for colon cancer till you get 50 anyway. So even though you're telling me about symptoms that look and smell and scream like, oh, I should be worried about colon cancer, I'm not even thinking about that just because you're at a younger age, right? So hopefully this is going to not only, train your physicians, right? Especially your primary care doctors that you guys are going to, right? Like you better ask them, right? Especially if you're watching this right now, right? If you're watching this right now, especially African American, right? African American, you're watching this right now. Smoker, you're watching this right now. Strong family history, you're watching this right now. And you're 40 years old, you should be asking your doctor, like, hey, can I go get a colonoscopy, right? Like, I don't want to wait till 45. Dr. Barry said I'm a high risk, right? And again, of course, you can't take my word for it. I'm not your doctor, right? But like, I strongly suggest, right? Like, you really have that conversation with your doctor because, the times are changing, right? Like I said, it used to be screened at 50 for a long time, right? So for a long time, we used to tell people, no, wait till you're 50 years old, and then you'll get a colonoscopy every 10 years, right? So then what happened? They started realizing that every people that they were waiting for 10 years was picking up colon cancer before that 10th year came around. So now they started saying, you know what? Yeah, you can start at 50, but you know what? Come back in 5 years, right? Maybe come back in 3 years, right? Hey, you know what? You may need to come see me back in like a year, right? Like, so we've already been playing with how frequently we're seeing these patients. Now we're just kind of moving, we're just shifting over, right? We're just saying like, hey, you know what? I used to say 50, but now 45 is that cutoff, right? So 45 is the age, the guideline, right? And the reason why it's important when we say what the guidelines say is because, especially for those with insurance, right? Your insurance company will usually fight you, right? Because that's what they do, right? Their goal is to not provide services. Unfortunately, I hate to say it. The insurance company's goal is to not provide services, right? So if let's say last year, right, I would have said, you know what, I want to get I'm a low risk patient, but I'm 45 years old, I want to get this colonoscopy. Your insurance company says, you know what, no, you don't qualify for it yet, you gotta wait till 50, right? But now that we got the guidelines out that says, know what, start them at 45, now your insurances will cover it, because your insurances, and again, I don't think most people realize it, getting a colonoscopy is like a wellness exam, right? So your insurance, especially if you're a GI, gastroenterologist codes it correctly, right? Like, I don't know how many times, and it's weird because I know that I hope the gastroenterologists are aware, right? Hope they understand, hope they understand, like, if you don't code correctly, right, the patient has to get billed, right? I'm gonna ask a question in a second. He asked, what about vapes, right? I'm not sure what comes in vapes. Right, I'd have to see when y'all vaping. I don't know what y'all actually vaping. If it's marijuana, vape marijuana, right? But like if you're vaping like tobacco, right? Then no, right? Again, tobacco, nicotine, absolutely terrible. don't do it. Don't kill yourself, because it's just terrible, right? There's no, again, like I said, in 2018, right? If you want to pick up a habit, right, smoke some marijuana, right? Do not pick up the cigarettes. Again, it's literally, I can't even think of a benefit, right? I can't think of one benefit that would say, you know what, yeah, go ahead and pick up that cigarette versus pick up a marijuana, right? Especially, and again, with a quick little side box, right? When you see these like COPD commercials, right? So I know y'all peeping these because, you know, they're making it all lovey-dovey, right? When you see those COPD commercials, majority of the time COPD is caused by these cigarette smokers, right? So every time I see a COPD commercial, right, I'm already thinking, oh, this person's a cigarette smoker forever, right? And now they want to take care of themselves, right? So I always say, you know what? You got to put yourself in that position for the COPD, right? So that being said, right, for sure, getting the colon cancer screening as early as possible, especially from African American population, who we already know we get affected by these medical diseases at a much higher rate than our other racial groups, right? That's just what the way it is, unfortunately. So again, now that, even though I'm saying like, yeah, 45 is the time that you go get your colonoscopy, right? If you're African American, if you're a smoker, you got a strong family history, you need to be at 40, right? At 40 is when you need to start, like, hey doc, I need you to see if I need to get this colonoscopy, right? Because if you came to me, right, again, I don't have outpatient practice, right? But if you came to me, I'd be like, yeah, you need to get this like ASAP, right? Like that needs to happen like right now for it, right? Because that's where it's at. That's where it's at, right? With no excuses. You know, it's a time and age where, like again, I don't want to have to take care of you because you got colon cancer that's spread everywhere, right? Especially when I hear that colon cancer spread everywhere, right? Understanding and knowing that colon cancer is slow, right? That means that you've been dealing with this colon cancer for at least 5 to 10 plus years before you went and got checked, right? So before you went and got checked, right? And again, some signs and symptoms when you think about colon cancer, right? Especially if you're concerned, like, oh, do I need to get checked, right? If you're having a change in your bowels, right? Like all of a sudden your stool used to be a certain color, now it's changing colors, right? Go see the doctor, right? If you're seeing blood in your stool, right? Go see the doctor, right? If you see your stool turning black, right? Go see the doctor, right? If your stool is getting smaller, right? And I talk to a lot of patients, right, who never look at their stool, right? Which is absolutely crazy to me. Like, they use the bathroom and I guess they just kind of like, you know, shut the toilet down and flush, right? Like, you should always, and again, it sounds gross, right? But this is your health, right? Remember, we're here to empower yourself to become, you know, better you, right? So if you're taking the number 2, right, just take, you know, quick look. I ain't saying touch anything, right? Just quick look, saying, okay, looks normal, and keep it moving, right? The second thing, and because you need to know what your normal is, right? If your normal is a certain size, then that's the size it always looks like, right? Because that way, when you know that when that size changes, I need to go see this doctor, right? When you know that you start seeing some blood, I need to go see a doctor, right? When you start seeing it changing colors, I need to go see a doctor, right? Like when you're having issues when you're eating and you're having like either an increased amount of diarrhea or an increased amount of constipation, any of those like big changes that's not normal for you, right? And I always stress normal for you, right? Because I have some patients who, let's say from a bowel standpoint, right? I got some patients, they go to the bathroom, take number 2, every 3 days. Every 3 days, like clockwork, boom, 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 I'm in there. I got other patients, right? Every day. Every morning, boom, number 2, I'm out of there, right? So if you're a patient who normally, right, goes to the bathroom every day, and then all of a sudden, like, it's been 3, 4, 5 days, I ain't go. Okay, you take some medication, all right, they'll let me go. But then again, 3, 4, 5 days, like, that's a change that you need to let your doctor know, right? That's a change that you need to be careful of. Again, I'm not here to tell you that everybody has colon cancer, right? We're not here to do that, right? I'm not saying everybody has colon cancer, but what I am saying is that there's no excuse, right? In this day and age, right? There's no excuse to be allowing yourself to deal with symptoms of colon cancer and do nothing about it, right? Like, we can't have that no more. Ain't happening. Don't do it to yourself, right? So again, I just wanted a quick little facts. Like I said, this is episode 56, I believe. Yeah, I think are we at episode 56 now? Hold on. I mean, yeah. All right. Episode 56. April. Oh yeah. So episode 56 of the Lunch and Learn with Dr. Pierre, the live stream video. I will have this on my YouTube page later on today, and I may just release like a quick little podcast audio clip of this as well. Again, just to make sure you are aware, everybody is aware of it, right? So let's do a quick little summary. Let's how we like to do these live stream videos, right? Quick summary, right? We have new cancer guidelines, right? The old cancer guidelines say, you know what? If you're 50 years old, that's when you start getting a screen for colon cancer. That's when you get the colonoscopy, or that's when you do that stool test that sometimes your doctor will give you a letter. You put some stool on it, you drop it off at Quest or LabCorp, and they let you know if there's blood in it, right? Before we used to say you got to be 50 to get that. Now we're moving it back, right? Now we're saying at 45 is when we get it, right? Dr. Barry is telling you, right, if you are a part of this group, right, one with a strong family history of colon cancer, right, one who is African American, right, one who is a smoker, right, like if those three things are you, right, like if you fit that, then I got a lot of people who fit all three. I take care of a lot of patients who smoke, or and you could still smoke or used to smoke. I got a lot of patients who have family history, like someone in their family had colon cancer or stomach cancer, some type of cancer, or the ones who are overweight. Like all these things here kind of play a factor, right? Not to say that you have colon cancer if you have all these three, but like if the risk is so high, like why not? We're not even testing it, right? Like 2018. We're not even going to test the fact whether we have colon cancer. We're just going to take care of business, right? And that's really our goal, right? We're going to take care of business, make sure we don't have colon cancer, make sure we're taking care of ourselves, to try to power ourselves for better health, right? So I'm going to see you guys later. Looks like they're already calling me do some work. You guys have a great and blessed weekend. And just want to kind of give a shout out to all of the Haitian mothers out there. Yesterday was Haitian Mother's Day, so shout out to you guys. If I did a video yesterday, I would have shot y'all yesterday, but we're doing a video today, so we're shouting y'all out today. Y'all have a great and blessed day. I'm going to see you guys next week. Bye.